Okay, if you're one of the millions of Americans receiving Social Security, you're going to want to hear this. There's big news on the horizon about a raise coming in 2026. But, and this is a big but, it comes with a pretty surprising twist, one that could actually leave you with less money in your pocket. So let's get into what's really going on.
And this is the million-dollar question, isn't it? A raise sounds fantastic on paper. Who doesn't want more money? But what does it actually mean for your bank account when all is said and done? That's exactly what we're going to unpack right now.
All right, so first, let's start with the good news. Every year, Social Security benefits are supposed to get what's called a cost of living adjustment, or COLA. The whole idea is to help your check keep up with inflation. And for 2026, it looks like another one is definitely on the way.
Right now, analysts are projecting that the 2026 COLA will land at around 2.8%. So, in theory, that's your raise. It's meant to make sure your buying power stays the same as prices go up. But what does that percentage actually translate to in real dollars?
Well, for the average retiree, that 2.8% bump will push their monthly check from about $1,865 up to just over $1,917. That's the new number, the new baseline you can expect to see hitting your account. So when you boil it all down, that new total means you're getting an extra $54 a month on average. And look, any extra cash is always a good thing, right? But this is exactly where the good news starts to get complicated. You see, that $54 raise doesn't just appear in a vacuum. At the very same time your Social Security check is getting a little bigger, other essential costs are climbing right alongside it. And in some cases, they're climbing a whole lot faster. The biggest issue here, the real elephant in the room, is healthcare. The costs for seniors are set to jump pretty significantly, especially for Medicare Part B, for your doctor visits, and Part D, which covers prescription drugs. This is the hidden part of the equation that just doesn't get talked about enough. So let's actually do the math. You start with that positive $54 from the COLA. Feels good. But then you have to subtract the rising costs. Medicare Part B premiums, they're expected to go up by about $21.50. And then Part D for your prescriptions could jump by as much as $50. And just like that, poof, the raise is gone. In fact, you could end up about $17 behind where you even started. This quote just perfectly captures what so many retirees are feeling. It's like patching one hole in the roof when 3 more just opened up. That little boost you get from Social Security is immediately swallowed whole by these other essential costs. It leaves you feeling like you're constantly playing catch-up, always one step behind. So why does this keep happening? I mean, how can a cost of living adjustment completely fail to cover the actual cost of living for so many people? Well, the answer is kind of baked into the system. It's in the formula the government uses to calculate the raise in the first place. It's all based on something called the CPI-W, and the huge problem is right there in the name. It tracks inflation for urban wage earners and clerical workers. Think about it. The spending habits of someone working a 9-to-5 job are just fundamentally different from those of someone who's retired. And here's where that disconnect really hits home. The current formula, the CPI-W, it just doesn't give enough weight to the things seniors spend most of their money on. And what's at the top of that list? Healthcare. That's why so many advocates are pushing to switch to something called the CPI-E, or the Consumer Price Index for the elderly. It would weigh those costs more heavily and would likely lead to much more realistic adjustments. This creates a massive gap between the official numbers and what's happening in the real world. So while the government might say inflation is 2.8%, a senior's personal inflation rate, driven way up by those healthcare bills, could actually feel a lot more like 4 or 5%. And this whole situation isn't just a one-time issue for 2026. This financial squeeze on retirees is really part of a much bigger picture, with a whole bunch of other systemic pressures that are all building up at the exact same time. In fact, this is pretty sobering. The U.S. Census Bureau reported that in 2024, senior poverty actually went up to 15%. And get this, people over 65 were the only age group to see their poverty rates increase. That tells you just how tough things have been lately.
And you can literally see these pressures converging on a timeline. The official COLA announcement in October of 2025 is going to happen right after Social Security finishes phasing out all paper checks. So for some people, that's a potentially difficult and confusing digital transition, and it's happening at a really critical moment.
On top of all that, just look at how much the COLA has swung around in recent years. It went from a massive 8.7% in 2023 all the way down to a projected 2.8% for 2026. Now, just imagine trying to create a budget for your year when your income changes that unpredictably. It makes any kind of long-term planning nearly impossible for people on a fixed income.
So, with all these pressures building, it's really easy to feel, powerless. But there are concrete steps you can take. There are programs out there that are specifically designed to help ease this kind of financial burden. First off, look into what are called Medicare Savings Programs. They can help lower your premiums if you're on a limited income. Second, apply for the Extra Help Program. That's one that assists with prescription drug costs. And finally, check with your state and local governments. They often have aid for things like utility bills or food. Honestly, a lot of people who qualify for these programs just have no idea they even exist. And that brings us right back to the core of the issue here. The annual COLA is a perfect reminder that the system often works a lot better on paper than it does in real life. It leaves us with a really fundamental question. Is the current formula failing retirees, and is it finally time we adopt a measure that actually reflects the real costs they face every single day?